Hi, I'm Dr. Jason Tripp right here in Hermitage, Pennsylvania. I'm a chiropractor and a naturopath. Today we're talking about shoulder pain. If you've had shoulder pain, you know it can be terrible. And so we want to talk about how to help the shoulder pain, how to help it get better, and how to do it as fast as we can. Now, one of the tests you want to do is you want to be able to raise the arm up and see if you can get it all the way over your head, right up next to your head. And if you get it up here, but you're like this, like you can't get it the rest of the way, then there's likely that you have a shoulder problem. Now, it can be anything from a minor shoulder issue all the way up to frozen shoulder, and really just any variation between depends on how it happened. Was there an injury or not an injury? Most of the time, though, I will say that there's not a major injury. It's repetitive motion of overuse that gradually builds up damage. So micro trauma, that's what they call it. So little bits of trauma that add up, little bit, make big bits. And so if you're having a shoulder pain or a shoulder issue, shoulder damage, then I want to encourage you that there is a way to help it without drugs or without surgery. So yeah, you can do injections. There is some place for that. You can do surgeries. There's some place for that. In most of the cases, the natural method is the way to go. So the way it goes is you do the test, the upper extremity test. You do that for the pain severity. How bad is that problem? Once you measure it, if you're over 85% damage, then likely the natural methods without drugs and surgeries are not going to work. That's when you need to go and say, yes, I do need to get a drug or a surgery at that point. However, if you're less than 85% damage, the natural methods work. You don't need to be in there getting a drug or a surgery. You don't need to get surgery if you have less than 85% damage in most cases. So my suggestion is to find out how bad you are. Do the upper extremity pain exam. Find out where you're at. Are you at 20%, 50%, 80%, or is it beyond and you're up at 80, 90, 100% damage? That way you can know what can be done. How do I get this thing better? Is there a way to do it without drugs and surgery? And if you've dealt with shoulder pain any length of time, you'll know. I mean, it's rough. We end up changing habits and not doing certain things, and we kind of give up on certain issues because we just kind of don't feel like there's really an answer. But I'm going to encourage it that there can be an answer. You need to find out today. Come in and ask for our shoulder pain severity exam, and we will take a look, see what we can do to help you. And if you can be helped, then I'll explain what you do, how long it'll take, all the therapies that you need, everything in advance. That way you know exactly what you need to do. But you got to call the office and make the appointment. So call now, 724-342-2225, or check us out at drjasontripp.com. I'll talk to you soon.